Hello and good day to everyone. We are from Group H. We'll be presenting on topic acute labyrinthitis. Acute labyrinthitis is an inflammation that occurs in the membranous labyrinth of the inner ear as shown in the picture. So a little bit of epidemiology. Labyrinthitis can be found in adults at age 30 to 60-year-old, children below 2 years old, and also following disease such as otitis media. So this picture shows the inner ear. So acute labyrinthitis occur at the part where color in orange. Risk factor for this disease includes increasing age, history of upper respiratory tract infection, untreated or partially treated otitis media, smoking, and also alcohol consumption. These are the three main causes of acute labyrinthitis, which include bacterial infection, viral infection, and also autoimmune diseases.
So, if you're having acute labyrinthitis, you may be presented with vertigo, which is induced by the pressure on your ear or cleaning the ear. You can also experience hearing loss, nausea and vomiting, and also ear discharge, ear pain, ringing in the ears, and also fever. Moving on to the types of labyrinthitis. Labyrinthitis have three types depending on the severity of the disease. You may have circumscribed labyrinthitis, diffuse serous labyrinthitis, or diffuse separative labyrinthitis. The details are as follows.
Next, here are the physical examinations that can be conducted in a case of acute labyrinthitis. First of all, a otoscope examination will be done. This is to inspect the ear canal and the tympanic membrane to check for signs of infection such as otitis externa or a cyst like cholesteatoma that could be the underlying cause of the acute labyrinthitis. Next, a tuning fork will be used to conduct tests named Weber and Rhine tests. Patients with acute labyrinthitis will most likely demonstrate a sensory neuro-hearing loss in the affected ear. Next, an ocular examination will be done, whereby the expected findings would be a spontaneous nystagmus towards the unaffected side. Next is a full neurological exam involving a cranial nerve examination, a gait assessment, cerebral function tests, and meningeal tests. Here are the investigations that can be carried out. First one is an audiometry to assess the extent of the hearing loss. The imaging of the brain, this is to rule out stroke, distinguish between a tumor and an infection, as well as vestibular testing. If bacterial meningitis is suspected, a lumbar puncture can be done, and if there is severe nausea and vomiting, a renal profile can be done, and a syphilis serology and HIV rapid test can be done in high-risk individuals, as well as an autoimmune screening.
Therefore, how do we manage the disease? There are pharmacological approach and surgical approach. Systemic antibiotics will be prescribed to the patient to help kill the bacteria. The pus will be cultured to identify the specific organism causing it. So the antibiotic will be given to prevent spread of infection. Next, sedative will be given, for example, prochlorperazine or dimenhydrinate. This is to relieve the vertigo symptoms of patients. Most commonly done surgical intervention is myringotomy, in which an incision is done at eardrum to relieve the pressure and drain the fluid in patient's middle ear. Referral is needed if patient having infection spreading to the brain, having recurrent episodes, and suspected insidious cause, for example, cancer. Here are our references.
Thank you.